This thing off here without causing too much discomfort. It's actually pretty soft around the. Hey guys, it's Dr. Carter here at Lexington Podiatry, and when you see these thick, gross, ugly toenails that we treat a lot, sometimes you think that you don't take care of yourself, and while that could be true, it's not always the case. Sometimes, in the case of this young lady, you can't get to your toenails. Spine surgery, knee problems, hip problems, they all prevent you from bending your foot up or bending your back over to get down to where you need. So we're going to make this young lady feel so much better today just by trimming her toenails and something on the bottom of her foot. So let's get started. Over here, you see, this is the characteristic Ramshorn. We learn about that in school. You don't see it every day. You do see some curves like this. This is a perfect classic case of a Ramshorn toenail. It looks weird and unusual, but it can actually become very problematic. On the bottom, the fourth toenail is actually digging into the third toe, and that can create a wound. So that's why it's really important to make sure that we get these trimmed down and prevent wounds from happening. So we're gonna, sorry that was loud. We're gonna get started.
That's what I had when I did this first one over here.
You had these big old nippers.
Mm-hmm.
So she tried, she just can't get to it, and the risk of cutting herself is definitely not worth it. So it's much better to come here and let us do the dirty work. So look at that. Awesome. I like it when they all come off in one big piece like that and they don't just crumble apart. You can see the full curvature of it. Look. There you go.
That's unreal.
It's like a little nugget. Yeah, and I know that they hurt, but I think it's that they build up so slowly.
They don't hurt. The callus hurts up on the bottom of my foot, but these don't hurt.
See, that's awesome. I mean, it's one reason that you allow it to go so chronically because it doesn't hurt.
Right.
But you know, you would think that these would hurt in your shoes and every step you take. And I think it's because they grow so slowly that you kind of just get used to it little by little.
Oh my God.
And before you know it, they look like this. And you're kind of in over your head at that point. How long do you think it's been since you've had a really good trim of your toenails?
I haven't.
You haven't?
And since I've been having arthritis and pain, no, because I wouldn't even go to a
salon. Yeah, a lot of people are embarrassed, but that's what they're there for. And us too. I mean, I would much rather you come here. They want to make you look pretty. And I get that that's important to a lot of people. But our goal here is to make sure that we trim them so they don't cause problems down the road. Once again, you're very welcome, honey. We've got these ginormous tools that look scary. You know, when I trim my kids' toenails, this is exactly what I use. They get scared because they do look scary.
I got the same thing. I tried on that one, but I couldn't bend over right.
Yeah. See, look, there's this big indentation where the toenail was wrapping around and curling back under there. I'm really shocked that that's not an open wound, but thank goodness it's not.
I've been praying and praying, and I told my son, I said, I know the Lord is tired of me worrying him. He said, Mom, he doesn't do that.
But he's just saying, go get your toenails fixed, young lady.
Now, if I hadn't, well, I was supposed to have hip surgery, and when they found the aneurysm, that's when he said, you go on and get your toenails done, and Dr. Hub recommended this. And I couldn't even, I slip the socks on and things, and I don't even look at them.
Yeah, out of sight, out of mind. I hear a lot of people say that. And you know, if it doesn't hurt you on a daily basis, then we're really good about putting things out of our mind and not worrying with it until it becomes a problem.
So how often should I come?
You know, it depends on how quickly your toenails grow. There are some people that need their toenails clipped every 9 weeks. There are some people that need their toenails clipped every 4 or 5 months. So it's really just a matter of how you like your toenails and how quickly they grow.
blessing right here.
Well, I'm glad, honey. I'm glad we can help. These are some of my favorite ones to trim because I can tell that I'm doing something and I know that I'm going to help you and make you feel better.
And I was supposed to have surgery the 6th of September, and then when they found the aneurysm, they said, no, we got to stop it.
Yeah.
And then that's when
Then you had the okay to get your toenails fixed.
I said, let me get these toes done.
Yep.
And I couldn't even believe they got in that bad because, like I said, I don't look.
Right. Okay. Well, I'm going to change positions here a little bit. We have a cutaneous horn that Dr. Frills is famous for on the bottom of your foot. So we're going to tilt you up a bit and you're going to come on down here. Let's see what this one looks like. This cutaneous horn means a thickened shell of skin that does look like a horn. And it's amazing to me that it can get so thick and so protruding.
And it comes back. I just put that one of those on for 3 days, and it came back in less than nothing.
Yep. The pressure that you put on it when you walk around builds it right back up. So we're going to see if we can get this thing off here without causing too much discomfort. It's actually pretty soft around the edges, and that is, look at that. That's because you've been putting those callus or corn remover pads on it. Now that's where it starts to pull, so we'll go super gently here, okay, and shave it down. You're starting to see that little core, and the core is different from the callus that surrounds it. The core, or the stalk, is where the majority of the discomfort comes from because it's so much more compact in there and hardened, crystallized even. You okay? Okay. So usually I will kind of shave around this a bit to hollow it out, because if we don't get that core out of there, it is going to build back up quick and her pain is not going to be as manageable as I want it to be. So this blade's obviously really sharp, but it does have a difficult time going through this, especially at the angle that I'm trying to get. Doing okay?
Mm-hmm.
Okay. So on the first time that we trim it, we may not be able to go down as far as I would really like to because it can be so sensitive. So if you get to the point where you're like, okay, lady, just give me a break, I can stop. I have enough of it off now, the big part, that it's going to feel better. It's just going to build back up quicker. But it would be my intention to see you in probably a month or so we could trim that down again. I could go so much deeper there, but I'm not going to because it will hurt her. While we're down here, let's just shave on this little callus too. It's not very bad. It looks worse than it actually feels once I start touching it and shaving it. Perfect. And let's do one more.
That right there is from trying to not walk on that callus.
Right, you walk on the side of your foot, and you are living proof that sometimes the compensation that you're doing can cause just as much trouble.
Damage.
Yes, ma'am. There we go.
I'm too close to 80 to be acting like this.
All right, guys, there you have it. We actually did something. We took these long, thick toenails and made her feel so much better. I would be surprised if she slides her shoes on and a big smile doesn't come across her face. I hope you guys have a good day. Thanks for watching.